Karishma Kagodu, both certified plastic surgeon practicing in Bangalore at Dr. Karishma Aesthetics. Let's talk about a thigh lift surgery. A thigh lift surgery is a surgical procedure which is done to remove excess skin and fat, usually in the upper as well as the inner portions of the thigh.
How do we decide whether to go for liposuction or thigh lift surgery?
So it all depends on what is the skin laxity and what is the amount of fat present in the thighs. Most of the individuals we choose to do thigh liposuction because they have a very minimal laxity or a moderate skin looseness, and they have minimal to moderate amounts of fat in these areas. And today we use the high frequency ultrasound and technology based liposuction devices, which also helps the skin to retract and tighten along with the fat removal. So it is very patient customized procedure. The thigh lift surgery has to be chosen in those patients who have undergone especially massive weight loss. This weight loss could be post-diet exercise or post-bariatric surgery where there is too much excess amount of skin laxity in the inner portions and the upper portions of the thigh. And looking at the patient, the skin quality, the fat amount as well as the age of the patient, the muscle tone of the patient, we decide whether we will choose a thigh liposuction or would the patient need a thigh lift surgery.
Is it done under sedation or general anesthesia?
A thigh lift surgery is usually always done under general anesthesia. It is preferred because it is a 2 to 3 hour surgery and the patient as well as the surgeon is comfortable during the procedure. So yes, general anesthesia is usually chosen and you may have to do a 1-night overstay in the hospital.
How is the scar going to be?
The scar in a thigh lift surgery is present on the inner side of the thigh. It extends from the groin crease and goes on the inner part of the thigh just above the knee.
Will I have a drain?
Yes, after a thigh lift surgery you will have a drain. The drain is usually kept for about 3 to 7 days depending upon the oozing which takes place from the body.
What are the other options for thigh lift without surgery?
Well, it all depends on the patient and it's a very customized procedure. There are various non-surgical options also to tighten the skin in the thigh. If you have a very minimal amount of skin laxity, not much amount of fat and you're just looking for a little toning and tightening, the non-surgical procedures like the Morpheus 8, which is a micro-needling radiofrequency technique, along with the Forma, which is a bipolar radiofrequency technique, is really good. It'll give you a tighter and toned looking skin. Now, if you have a little bit more amount of skin and a moderate quantities of fat, you are looking for creating a thigh gap and you want to reduce the bulk, thigh liposuction can be chosen. You will get fat reduction as well as a moderate amount of skin tightening. But if you are a patient who has lost massive amounts of weight, who has extreme skin laxity, a lot of fat, and possibly not fat but at least extreme skin laxity, and you have a lot of stretch marks, wrinkling in the skin, then we will choose a thigh lift surgery for you. So we will have to meet you in person and customize the procedure for you and decide you are a candidate for which procedure.